topic that we can all relate to because it's so prevalent. Even I can relate to it because I, believe it or not, also suffer from low back pain. Despite how young I am, I suffered it for about 2.5 months, about a year ago. It was pretty excruciating. And, despite having seen so many back pain patients, having suffered it through myself, it was the first time I can truly relate to my patient on another level. So this lecture, the whole point is not to have you guys as an expert of low back pain, but rather to educate you on what to look out for, what are some of the causes of low back pain, and why is it so hard to treat it sometimes. Okay? So this is my title. So we're gonna first start with the definition of low back pain. So low back pain is basically a disorder of anything that's happening in the structure of our spine, especially the lumbar spine. And you can see it in the red area over here. And it's a disorder of bones, joints, nerves, spinal cord, and basically any other structure that's in the back. And if there's anything going awry with it, it will cause pain. Now, as you can imagine, low back pain is not something new. It's been in existence since the birth of human mankind. The oldest documentation of low back pain started or is seen in ancient Egyptian medical literature dating 1500 BCE. Now, when we talk about our spine doesn't start in our lower back. It starts from our base of the skull all the way down to the buttocks. And there's 5 components that comprises our spine: cervical, which is the neck; thoracic, which is the mid-upper back; lumbar, which is the lower back; sacrum, which is more of the tailbone area and the buttocks; and the coccyx, which is the tailbone itself. Now, I'm gonna primarily focus on lumbar region, which is a low back pain, because that's our topic today, but also because based on how our spine is designed, most of our weight is carried by our lumbar spine. And that is the reason why lumbar spine is the #1 target for degeneration, arthritis, disc tear, all that bad stuff. And that's, again, the reason why low back pain is so much more common than middle upper back pain or a neck pain. Okay. So this is a brief anatomy of how our spine is structured. So this entire, let me just use a mouse pointer here. This entire is a 1 vertebral unit, okay? And if you focus on this blue material here where the pointer is, that's the disc. Now the disc is composed of 2 things or 2 structures. The one in the middle is called nucleus pulposus. You don't have to remember the name, but it's basically a sponge gel-like material that serves as a cushion for our spine. This is the one that allows us to move the back the way we want to, bend forward, bend backward. It also allows us to lift something heavy without bone touching on the bone, because there's that cushion in between every single level of our bones. And again, it's gel cushion-like, so it can absorb high amount of stress without causing any sort of bone fracture, okay? And that sponge-like material is held up by that dark blue circle, which is more over here. And that's a disc annulus, which is a fibrous ring. And fibrous is basically another word to say rubber band-like structure. So if you think about it, it's a gel-like structure held in the confines of a rubber band, okay? Now, if you go to the back of the disc, this is the disc, so the back of the disc is the spinal cord and the spinal nerve roots. And as you can imagine, spinal cord and spinal nerve roots carry the function of providing sensation in our legs, our arms, and also the motor function of it, okay? And right behind our spinal cord is, and it's unfortunately not shown in this diagram, but these joints right here is called facet joints. And these little joints in tandem with the disc allow us to do whatever we like with our spine. And because it is a joint, it is also prone to arthritis, just like our knees, hips, and shoulders. Okay, so this picture, I put it up there just to show the natural curvature of our spine. So as you can see, depending on the segment of our spine, the curvature is a little different. And this is to make sure that the cervical spine, which is the neck portion, is curved in such a way that it can support our head and our face, really, in an ideal way without putting too much pressure on our disc and our joints. Thoracic spine doesn't really serve a lot of function in supporting our weight. And again, lumbar curvature, lumbar spine is the crucial portion of our spine that carries bulk of our weight. And as you can see, it has that little bit of that C shape of the lumbar spine. And this is very crucial, as if you deviate anything from this, that it will put undue balance between the disc and your joints, and it will speed up the arthritis basically, okay? So I know when we were growing up, All of our parents used to say, keep your back straight, sit up straight. That old adage still stays true. Okay. All right. So a little bit of the incidence of low back pain. I'm sure you and or your family members have suffered from back pain at one point or the other. If it makes you feel better, up to 80% of world population has had back pain at one point in their lifetime. And at any given moment, even the second, up to 12% of world population is suffering from some sort of low back pain, okay? And that's roughly about 600 million people. The low back pain is not discriminatory. It affects men and women, all races pretty equally. And low back pain, unfortunately, can affect as early as 20. I've even had a patient who was 18 years old with back pain, which is unfortunate. And it becomes more prevalent and more frequent as older as we get. If you look at the graph on the right, this is a pretty interesting graph. So if you see it closer, you'll see a dark blue line, and you'll also see a light dotted blue line, and you can really start to tell a difference around here, okay? So this right here is the age, and this right here is the severity of the back pain, okay? So back pain starts around 20. In this graph, it shows a little bit on the 30. So that's when you first get the spike of back pain, and you realize, oh, something's wrong. And then it goes right back down. Back pain, usually in your 20s and 30s, doesn't last that long. And then you forget about it. You kind of go on your daily routine activity. You go to 40s and 50s and become more severe. Higher it is, the more severe it is, and also more frequent. And this is when you start to realize, okay, something's going on with my back. Maybe I should see a doctor. And you see a doctor, maybe you get an injection, maybe you get a medication, you feel good again, you kind of go on about your daily activity, and now you get a big spike over there. That's usually when the disc has torn to the point where it's herniating, pushing on your spinal cord, pushing on your nerve roots, all the bad stuff. And that's from that point on, it kind of becomes sort of uncontrolled back pain. If you look at the dotted blue line, the difference between these two is the difference between two people. One person who kind of went about their daily life, not really caring about their spine. I can always get an injection. I can always get a surgery. And another dotted line is for people or person who took a mindfulness of their low back and really, from the moment they start having back pain, keeping their back straight, working out, exercising, making sure that they protect their back by strengthening the muscles around it. So this is a true graph based on many different patient population based on what route they took. And you can see a significant difference, especially in your 50s. Okay, so some of the risk factors. Unfortunately, the number one risk factor is age, which is not hard to guess. This is because as we grow older, degeneration becomes part of our life. We can't avoid it. It's just part of our nature. For some people, it may happen a lot earlier. So for some people, it may become a lot more severe early on. Lack of exercise is actually also a very big risk factor. And this is because the less you exercise, the weaker the muscles become because they're not being used. And if the muscles are not being used, who's supporting the body of your weight? Sorry, the weight of your body? The disc, the joint. And they don't like that. They're gonna start telling your brain that you're in pain. So they're gonna make you suffer for that. Excess weight, sort of in a similar picture. A lot of weight in your body, especially the necessary weight, unfortunately goes to the disc and your joints eventually, causes pain. I want to really hone into the family history of low back pain, meaning if you have any siblings, if you have any surviving parents who suffer from low back pain early on, chances are you will also suffer from low back pain. Our disc, our joints are heavily genetic. The elements that comprises our spine is heavily genetic. So if you were unfortunate to be born in a family with bad spine, you are probably born with a bad spine as well. Back pain may come to you sooner than later. I'm unfortunately one of that group. My mom suffered from low back pain in her 30s. She had a discectomy, which is a shaving of the disc at age 39. And then from that point on, she had back pain for another 30 years, essentially. So knowing that early on, I knew it was coming for me. The last two, this one, improper lifting, labor-intensive career is sort of obvious. If you're into heavy weightlifting or if you're a weightlifting champion, if you're a professional sports, like an athlete, golfer, or if you're doing a lot of janitorial work, back pain might come to you sooner rather than later because all that undue pressure and stress is going to your spine. And lastly, smoking. This is not my agenda to promote quit smoking. The smoking actually is related to low back pain, and the main mechanism behind it is if you smoke, it decreases the blood supply. that goes to your disc and your joints. And your disc and your joints need food to survive as well, the nutrients. And while it's doing all the work, if you decide not to feed them by smoking, then your disc is gonna again yell at you by degenerating and causing you back pain. Right? So prevention, some of the things I already kind of touched base on. Exercise, it doesn't have to be weightlifting, it doesn't have to be heavy core muscle exercises per se, but going out for a walk, going out for bicycle riding, swimming, anything just to get out and be active is better than nothing. Keep those muscles active, okay? If you be active and while being active, follow that picture with all the green check boxes, keeping your back straight, walking with your back straight. When you look at your phone, don't look at it like this. Look at it from far away with the neck straight, back straight. Sitting, even lifting. When you're lifting, don't lift with your back bent. Let your legs do the work. Lift like this, keeping your back straight, for example. Even when you're sleeping. Sleeping is a little bit more out of control because there's no way you can control how your spine is positioned while you're sleeping. But if you can, sleep in a position where your back can stay straight. That will be tremendously helpful alone. And if you're a go-getter trying to get extra credit, then you can also try to get some core muscle strengthening, which really focuses on the muscles of the back and muscles of the belly. And these are crucial as those are the two big group of muscles that help us carry that workload and carry our body weight. Okay. Again, maintenance of the natural spine curvature, which I already mentioned. Healthy weight and diet. Ideally, they'll be possible. Even if you don't necessarily do this, if you're doing everything else, then you're slowing down progression of back pain by a lot. And again, no smoking. So low back pain. I'm gonna get my water right there. The low back pain can be classified into 3 different categories depending on the timeline of it or how long it lasts really. First is acute, which is 6 or less weeks. Subacute, which is 6 to 12 weeks, and chronic, which is 12 weeks. Now, in general, the low back pain, in general speaking, low back pain resolves or improves within the first couple of weeks, and by the 6th week, it gets better. So when you come to a doctor's office, for example, and you have back pain that's been going on for 2 weeks, most doctors may say, why don't you try this medication? Why don't you try physical therapy? Why don't you do X, Y, Z? But they won't say, let's do an injection right now. Let's do surgery right now. That's because they all know that back pain oftentimes resolves on its own, okay? And oftentimes it resolves on its own, but if you want to really help yourself and don't want to deal with the pain, you can try over-the-counter stuff. Ibuprofen and Advil, naproxen helps a lot because they're anti-inflammatory. Tylenol can certainly help as well, not as much as some of the other medications I mentioned, but they can certainly help. You can certainly try some physical therapy, ice, heat pads, some topical stuff like Salon-Pos pads, BioFreeze. All these things may not necessarily be home run, but all these things added together can certainly help with the pain. Now, these are some of the causes of low back pain: heavy lifting, trauma, poor sitting posture, degeneration, obviously. And some of the other diseases in your belly that could cause back pain. We'll go over that a little later. So these are some of the types of the low back pain. Again, you don't have to memorize all these. There's no quiz at the end. This is just to show you how complex it can be to treat low back pain. I see a lot of patients who come in with low back pain and say, well, my friend got an injection. Why can't I get an injection? And the truth is, I wish it was as simple, but unfortunately it's not. So these are all the types of back pain that we'll go through one at a time. The number one thing, if you don't remember anything from my lecture, which will be unfortunate, but if you don't remember anything from my lecture, remember the disc, okay? Disc is, I would say, the number one cause of our back pain, and it's also the first step of our back pain. If you ever have back pain for the first time ever, likely 99% of the time is coming from the disc, okay? Excuse me. So the disc, as I mentioned, is there's a little gel in the middle, and there's a little rubber band on the outside. If you look at the picture on your left, when you bend forward, the disc, the gel part, really wants to come out backward. And you can see that on that little blue jagged line. And what that's doing is, I want to get out. I want to get out because you keep bending forward, and for whatever reason, you keep staying there. So the disc wants to get out. And the rubber band is trying to keep that in. Now, when you're young, your rubber band is strong. When you're older, rubber band is not that strong. So it starts tearing and tearing. And when it tears, that's when you start having this pain. And this pain is usually something that you know it's there, but you can't get at it. You try to touch it, you try to really grab it, but it's hard to trigger it. Sometimes if you get lucky enough, when you go forward, you can trigger that pain. And when you go backwards, it feels a little better, but it still feels achy. Now, if you look at the picture on your right, when you go backwards, it puts that jagged tear together, meaning if you put the torn spot sort of together, and that actually promotes healing. And that's one of the reasons why I want you to keep your back straight in case you have a disc tear, okay? Whether it's silent, meaning you have no symptoms, or whether you have pain from it, keep your back straight, okay? And this tear, the discogenic pain, the number one treatment is time. Tear will heal on its own, just like a paper cut in our hand. Think about it as a paper cut in our disc. Unfortunately, it's invisible because you can't see it, and that's why it's frustrating. If you have a paper cut or injury and you see it, you know it's healing because you can see it and you feel better despite the fact that you still have pain from it because you see it healing. This pain, you don't see it healing. So if you have pain, you start getting frustrated because you feel you're going nowhere. All right. So that's the number one treatment. If it doesn't go anywhere after 12 weeks, 16 weeks, this is really making you miserable, then some physicians can start you on some of the medications. They may even do an injection for you, called epidural steroid injection. Mind you, epidural steroid injection doesn't really help with disc pain. All right, and this is some of the other pictures for the disc. I won't really spend too much time on this, but basically the picture on the left, you can see the disc is being torn. The sponge material is going to start to herniate backwards. And if you look at the MRI picture, which is on top, you can see the dotted line of disc, the sponge-like material of the disc, start to herniate backwards, okay? And these are some of the other ways you can really hurt your disc, lifting something very heavy from bottom up like this, or trying to hold on to something heavy with your bent back backwards, okay? All right, so this tear, if it gets significant enough, eventually will lead to herniation. That sponge material will finally go through all that rubber band and say, I'm out. And this is the picture. The disc sponge material on the bottom right, you can see that it's herniating, it's coming out now. On the MRI, you can also see that as well, herniating out. And if it herniates out, and if you've been paying attention to my anatomy slide, right behind the disc is the spinal cord and your nerves. So then the disc herniation will start pushing on those stuff. And once it does, you will start having what we call radicular pain. And this is also known as sciatica. So when it starts pushing on the nerve, you start having shooting down pain on your left, on your right. Sometimes if you're unlucky, both. And depending on which nerves are involved, you can follow this picture. Your pain will go in a very specific distribution, okay? Again, if it gets bad enough, your nerves start not functioning the way it wants to. It'll start causing numbness. It'll start causing weakness in your legs, okay? Now, the good news is just like the disc tear can heal on its own, most of the disc herniation, as long as it's not too severe and it has been happening for a long period of time, it can go back into a spot, okay? You just need to give it a time, chance, and also keep your back straight in the meantime. Obviously, this pain, for people who have actually suffered this pain, it can be excruciating, and it's not something you can tolerate just by saying, keep your back straight. So this is actually one of the few types of low back pain where injections will be tremendously helpful. And that's one of the reasons why a lot of people do epidural steroid injection for this type of pain. You can also try medications such as gabapentin or Lyrica, if you've heard of it. Those are really nerve type pain medication. If it's really bad, if the pain is really bad, injection is not helping, then sometimes surgery might be needed. They go in there, they try to remove the fragment of the disc that's pushing on the nerve, and sometimes that will cause immediate pain relief afterwards, okay? All right, and this is some of the pictures, or really the drawing of how the patient would describe their radicular pain. And usually, as you can see, it's kind of going down on one leg or the other leg. Sometimes it goes on the back side of the leg. Sometimes it's on the side of your leg. It also incorporates some of the back pain. Sometimes, if you look at the picture on the right, you may also have some upper back pain, and that's because your muscles are now doing the work to keep your back straight because your disc can't do so anymore. And this, as I told you, it starts with the disc, and now it can go to radicular pain or sciatica. If you look at on your right side, that's the disc pain. As it gets worse and worse and worse and kind of becomes herniation, disc herniation, and then radicular pain, that's how the pain progresses all the way to the left. And as I told you, the disc fragment can be absorbed. It can kind of go back into shape. Once it starts doing that, it will start going back, kind of like a pendulum, all the way back to the disc pain. And if you've really been a good person and a fortunate person, disc will completely heal without you having to have done any surgery, and that pain goes away. Now, spinal canal stenosis, It's a little bit more rare. Basically, it's squeezing of the spinal cord more so than the nerve, like a radicular pain. And basically, this pain is low back pain. Sometimes it can have some crampy, achy like pain in the thigh. And this pain is it's interesting because when you bend forward, and I just told you all this time, don't bend your back forward, it makes your pain better. And this is because when you bend your back forward, it actually, the way our spine is designed, it actually opens up the space for your spinal cord to breathe a little bit. And when you stretch like this, your back pain gets worse. And that's because your spinal cord is being squeezed. And so this is especially hard to treat because I want your back to be straight. I want you to try all these medications for physical therapy, but most patients can't do that because every time they keep their back straight, it's squeezing their spinal cord and they're dying in pain. So a lot of this, I will try to do medication. I'll still try to do injections, but most oftentimes those are not sufficient enough and they need to have surgery done where the surgeon would remove the pieces of the bone to open up that space, allow the spinal cord to have a breathing room. And so this is some of the classic symptoms of lumbar spinal canal stenosis, where keeping your back straight and walking is miserable. They can't even walk more than 15 feet at a time. The moment they sit down and rest and bend their back forward, the pain goes away immediately. Some people call it shopping cart sign, where when you go shopping, I see a lot of patients saying, when I go shopping, my pain goes away. And that's because when they lean on their shopping cart, their pain goes away and they're shopping with the shopping cart. So then for that brief period of time, they're in no pain. So I have actually had some patients look forward to shopping because of that reason. All right. So this is the MRI picture. So the top picture is the spinal canal stenosis, and I'll use the mouse here actually. Right this level, you see all this level. This is a spinal cord, this bright white material. And you go right here and oops, it stops right here. It doesn't actually stop, but there's so narrow of a space that if you look at it here, this is normal spinal cord, the level above, and the moment it gets there, it's very squished. So your spinal cord is certainly not happy and will cause some low back pain with that. And this is actually a very promising picture to show you that I wasn't lying. Your disc fragments, your disc herniation does go back into a spot if you give it a little time and proper physical therapy. And I'm going to walk you through it. This picture on the left over here is a 35-year-old male who had low back pain and some radicular pain. And the picture on the left side is before, and it's 6 months after physical therapy, keeping your back straight. And I believe he may have also got an injection done. If you look at it on the right side, the disc fragment has gotten a lot smaller and the spinal cord is more happy. I know this is a 35-year-old gentleman, but if you look at on the one on the bottom, this is a 70-year-old gentleman. Took about 20 months, which is a little bit longer, but his disc fragment, which is also herniating backwards, has resolved pretty significantly. And you can see it on the bottom left picture, how significantly the disc has sort of regressed and the spinal cord has more room to breathe just by keeping their back straight. Does not need any surgery. The bottom right and bottom left is a 51-year-old female and then mid-60s female. So just to show you that it's not discriminatory. Male or female, doesn't really matter. The disc will go back to this spot as long as you give it a chance. All right, so arthritic pain is another component of it. As I told you, there's a little joint behind our spinal cord that makes us do whatever we like. And those joints will also be prone to arthritis, just like your hip and your knees. Unfortunately, for the arthritic pain in our back, there is no replacement surgery. With your knees, hips, you can get those replaced, not for these. So you really got to be careful and really got to take care of your back and your spine. Some of the treatment options for this arthritic pain would be steroid injection. Sometimes there's a little pesky nerve that goes around the joint, and that nerve, all it does is tell your brain that you're in pain, and that serves no other purpose. So what I offer and what really a lot of other pain doctors offer, they go right next to that nerve and they actually burn it away. It's not a physical fire, it's not a physical fire. The needle tip just gets a little heated and it kind of disconnects the nerve. And I know that freaks some people out. Rest assured, the nerve goes back, but that's not really good news because then your pain comes back. So the nerve burning oftentimes lasts about 6 to 12 months because that's how long it takes for the nerves to wake up and grow back, unfortunately. And then we have to go there and burn it again. But at least that's something that can be highly effective in treating the arthritis pain. And this is just a really complicated picture. You will think arthritis, if you have in your lower back, it will stay in lower back, but sometimes they can have what we call referred pain, achy pain down your leg. And if you have been paying attention enough, you will say, hey, doesn't that sound familiar to radicular pain? Yes, it is. And it makes my job a lot harder. But basically, back pain can be very complicated in those reasons, because some of them can overlap with one another. And sometimes you could be having both. So if you have an injection for radicular pain, but you come back angry saying the injection didn't work, that's because maybe it took care of the radicular pain, but now you still have the arthritic pain with that referred pain down your leg. Okay. This picture is also I found it very interesting and very helpful. If you have a normal disc, our weight distribution happens in such a way that 44% of our body is handled by the anterior disc, the front side of our disc, 48% back side of our disc, and only 8% in our joints, the set joints, I call them. If your disc is degenerated, and I promise you, disc is the first one to go, because the gel-like material is not really gel-like anymore, all that stuff. Once the disc is degenerated, it can only handle 19% on the front side, 41% on the back side. So if you do the math, there's 40% hanging around somewhere, and unfortunately, gravity will do its job and have it pushed down. Now your joints will carry that 40%. Your joints will definitely not be happy because they're getting paid the same amount, but they're doing more work now, right? So once the disc goes away, the next one to go away is the facet joint. Your joints will start getting arthritic pretty fast. Okay. This is just to cover the fracture portion of your back pain, vertebrogenic pain, I call it. The fractures can only happen in so many places in your back, the most common being that big giant bone in the front. And usually these happen in, unfortunately, elderly women more so than men. So this is a little bit discriminatory. And this is because women are a little bit more prone to osteoporosis, which is a fancy word of saying your bones are not being mineralized, it's lacking calcium. And this is purely because of hormonal issues. And once that happens, your bones are a little brittle, it's become weaker, it's more prone to fracture. And this fracture doesn't necessarily happen because you fall. Sometimes you could be lifting something heavy and you have back pain, you get an X-ray or CT scan, and doctor comes and tell you have a fracture. And you say, that can't be possible, I didn't fall. But that's because your bones are so weak that even a little bit of pressure is causing fracture. Don't be worried, with all fracture, it does heal on its own. Sometimes brace and physical therapy is all you need. It takes 3 months to completely heal. The pain can be brutal, however. So if you cannot handle the pain, then some physicians, what they can do is they can go in there and inject a medical cement, not a real cement, medical cement, and that will not only restore the height of your bone, remove the fracture, but also heal or treat the pain away immediately. This, I won't go too much into because I'm running out of time here, but basically this is to show you have a lot of muscles that can carry the work. And if your bone, your spine, your joints, your disc is failing to do its work, you have a lot of support structures and ensemble to help with that weight loading. So all of a sudden you're not walking like this, you're still walking upright more or less, but now you have achy, crampy pain, some muscle spasms because your muscles are doing all the work. And these are some of the organs in your belly. If they have some issues, they can also cause back pain to make my job harder. And this is a graph to show you where each organ would cause a referred pain too. Right? All in all, low back pain is complicated. Not only is there multiple different types of low back pain, they can also happen simultaneously. And that's the reason why injection or medication is sometimes not a one-time fix or one-time solution. Sometimes you need to incorporate a lot of different therapies to treat low back pain as a whole. Back pain is often invisible, which is even more frustrating to keep track of its progress. And I need to remind you, none of these treatments are really cure for low back pain. So that really goes to my next message or public service announcement. You really only have one spine. There is no replacement surgery. So even if you guys don't have back pain today, please take good care of it. Please keep your back straight. Please be active, even if you're lazy like me. And if you have back pain, you see a doctor and the doctor recommends physical therapy, don't sigh at them because you're not getting an injection that day. Physical therapy will give you the most mileage out of your spine, okay? Degeneration happens to all of us, so don't be discouraged if you have back pain. I had it too. And we can all together slow it down if you're a little bit more conscientious of our spine and the health of it, okay? These are some of the exercise. I probably should make another lecture just focus on the exercise. It's impossible to cover the entirety of low back pain and treatment in one lecture, unfortunately. But these are some of the exercises you can do. A lot of it really focuses on your abdomen, your glutes, and your back. Plank, whether you're doing a front plank or a side plank, that will really help with the abdominal muscles. Sometimes you can do some light curl, not all the way curl, but light back and forth curl that will help with the abdominal muscles, protect your back. Okay, and you can do some good gluteal exercises over right here, where you're lying on the mattress and you're kind of doing the hip up like this, and that will help with the glute muscles, which also support our back. Lastly, watch out for these reflex symptoms. If you're starting to have progressive weakness in your leg, numbness in your groin area, you start unable to empty out your bladder, empty out your bowel. These are some of the symptoms to watch out for. And especially if they all happen together, those are emergency. You have to go to the emergency room. They will get an MRI scan, and likely they may have to do a surgery on you right away because your spinal cord is in danger. Okay. So these are the take-home points. Back pain is complicated. Come see me if you need help. But more importantly, take care of it yourself. There's a wealth of information out there. Educate yourself with knowledge, arm yourself with knowledge. Go on Google, type up how to treat low back pain with exercises. Try all those exercises on YouTube. I highly encourage it. They're all wonderful. Most of them is really taught by physical therapists, and they're experts in those exercises, more so than I am. There is no one treatment, so don't come in thinking there's one treatment that fixes it all. If you're one of those few category of patients where actually one injection does treat everything, good for you, but know that you're the exception, not the rule. Okay, and take the reflex symptoms seriously. Okay? If you start experiencing some of these symptoms, don't hesitate to call your doctors. Okay, that's what they're there for. Okay, don't feel like you're bothering them. Your health is first. Your spine is first. Okay. Thank you for listening. I know that was a lot of information. This is my location. I primarily see patients in Westerly, right down at 11 Wall Street, but I also do see patients at East Greenwich and East Providence for folks who are not close to Westerly. So I'm done for the presentation, but I will take any questions in the room first, and I'll move on to the webinar questions. Yes, sorry, go ahead.
Question about mattresses and sleeping positions.
Mm-hmm.
Better mattress that you could use.
Mm-hmm. Right. Mm-hmm. Right. Mm-hmm. Yeah, no, that's a very good question. So a young lady in our room asked a question of what is the best sleeping position, whether there is an ideal mattress for your back, and whether you should be using a pillow, and just overall sleeping position for your back. And let me kind of go back to that picture if I can ever find it. I know I have a lot of slides, but to answer your question, firmer the mattress, the better, okay? So I'm not talking bad stuff about Tempur-Pedic or one of those mattresses that promote themselves as if you're sleeping on a cloud, because that's what it feels like. Unfortunately, when you do that, you kind of feel like you're kind of being absorbed into the bed, as they call it, or the sand dunes. And the ones that happens, your back is impossible to keep your back straight. It goes in like this. While it's comfortable to sleep like that, it will certainly be damaging to your back. So firmer, the better. It doesn't have to be rock solid because then you can't sleep, but mildly to moderately firmer, the better. In terms of your pillows, the pillow really affects more of the cervical spine, more so than lumbar spine. But if you're a side sleeper, make sure so if I'm sleeping on the side like this, make sure the pillow is big enough. And sometimes you may even need to use like a 1.5, 2 pillows. So make sure you're sleeping like this, not like this. Okay. And if you're sleeper that faces the ceiling, then very low height pillow, should I say, is enough to keep your cervical spine a little bit flexed, but not too much. It shouldn't be 2 pillows or more when you're doing this, because then that's really bad for your neck. Okay? I hope that answered your question. Mm-hmm. Mm-hmm. Yep.
It looks as though the middle one is saying his mattress is too hard. Is that right or not? What is
Mm-hmm. Very good. So that's that's a very good point. So the second picture, especially right there, is one of the reasons why you don't want hard mattresses, too hard of a mattress, because then it's not really flexible. So then you're sleeping like this, really, or you can't, like your shoulder gets in the way. So this side of the back becomes more like this. Okay, so it needs to be flexible enough where basically the midline of your spine is middle, but still firm enough where you're not kind of grounding into the bed. That's why it's hard. I wish there was a mattress brand I can promote. Unfortunately, I haven't found the perfect one myself, but is moderate firm mattress that will be the most helpful. Sometimes the spring mattresses do that type of job. If you're going to more of a cotton or like feather made or water mattress, for example, those will be the worst. And again, don't sleep in a hard rock bottom or floor or anything like that. Okay. I don't know if that was helpful, but that would be my recommendation. Sleep. Not necessarily. It really depends. I don't want to say this. It depends on your body habitus a little bit. If you're more of a bigger gentleman or bigger lady, if you sleep on your belly, you end up flexing your back a little bit. So it really kind of depends on your spine. It's very plausible for you to sleep on your belly and keep your back straight, but I would imagine that may be a little uncomfortable. But if you can do it, that's fine with me.
The main thing is keep your spine straight.
Yeah, and not only straight, but have the nice little curvature to it.
Yeah.
Okay.
Oh, yeah.
Yeah, that little C shape. Yeah, go
Is
ahead.
it all right to wear a back brace to help you walk, to keep your back straight?
Gotcha. So the question is back brace helpful for back pain, and should I be wearing it? Yes and no. So back brace, I recommend it to some patients as a reminder to keep your back straight. If you're wearing something that reminds you that your back should be straight, you're gonna keep it straight. If you rely on it too much, then that back brace, no matter how flimsy or strong it is, it starts supporting your spine a little bit, and that could be bad because then your muscles are taking a break. Your muscles like, oh, we got a U10. I'm relaxing now, and you can't live with the back brace forever. So at some point, you gotta take it off. Once you take it off, your back muscles on a strike. It's weak. It's not gonna do the work. All that weight goes to your disc right away. So my recommendation is if you're gonna use a lumbar brace or back brace, it's fine up to 2 hours a day. Yeah, question in the back.
How about putting a pillow underneath your knees?
Underneath your
Does
knees.
that help?
That certainly helps because if you don't, sorry, the question is can you put pillow between your legs to help with your disc or your spine? So the answer is yes. If you don't put pillow in your knees, it's not the end of the world if you don't, but if you do that, then your pelvis tilts a little bit because unless you're, again, a fluffy individual, your feet will get together a little closer and your pelvic will tilt a little bit, and that could put some undue balance on the disc. So if you can find a comfortable pillow position in between your legs, and you'll know if it's comfortable, chances are your pelvis is not tilting that much, then your spine is more likely straight. So to answer your questions, I would recommend that you put pillow in between your legs. Yeah.
I have a sciatic,
Mm-hmm.
starts from on this side here.
Mm-hmm.
Will that affect the back?
So the gentleman's question was, he has sciatica on his right leg. Would that affect his back? The sciatica itself doesn't affect the back, but rather the sciatica or this radicular pain down your leg is coming from the back. So usually when you have pain in the leg, and sometimes interestingly, you may not have back pain. You just have shooting down pain in your leg. Know that majority of the time it's coming from your back and you need to get your back checked out. Okay. But just because you have sciatica doesn't necessarily mean that it will affect your back. It's really the other way around. Your back is affecting the sciatica. Okay. Yeah, Tony.
You had touched about the red flags symptoms.
Yep.
And I'm curious about the term drop foot and how that may fit into red flag scenario.
Yeah, so drop foot is a very specific nerve that's being pushed around, and it certainly could be placed in a red flag symptom. It really falls under a more broader term of weakness, as I mentioned. If you have any sort of worsening weakness, it doesn't have to be drop foot, it can be the whole leg. And you feel like it's getting worse and worse, and it's obviously noticeable, then it's better that you go to see an emergency room because somewhere along your spine, your spinal cord, your nerve root is being pressed along pretty fast. And if it happens really fast, then your nerve doesn't have time to recover and it will cause permanent nerve damage. So foot drop could be one of the examples where if you're fine the morning of, but then in the late afternoon, you all of a sudden can't lift your foot is dropped, then it's a very good idea to get that checked out. Okay. To answer that question. Any other questions? Yeah.
If one of these ribs have been fractured,
Mm-hmm.
was that due to the spine?
So the question is, if there is a rib fracture, what does that do to the spine? If it's usually one rib fracture, doesn't really do much to the spine unless your spine is so degenerated that any sort of imbalance in the weight will cause increase in pain, which is,
Try 6.
yeah, that will. So she said 6 rib fractures. That could certainly impact the dynamic of the weight. So basically, if you have fractures in, especially 6 fractures on the one side of the rib, for example, that a lot of the weight that was confined or held by your chest wall, the ribs cannot be, it can't happen anymore. So then the weight ends up being held by your all the remaining ribs and your thoracic spine. You kind of got me there. That'll be one rare example where your thoracic spine has to sort of carry the work. Now your thoracic spine is not really used to carrying the work, thoracic spine being the middle upper back. And for a small period of time, it can, because it's been healthy, it's been sort of cycling along all this time. If you have this 6 rib fractures and it's taking forever to heal, you will start to have some mid upper back pain. Okay, and that means the degeneration has already started happening in the thoracic spine.
Okay.
All right.
You talked about physical therapy and exercising.
Yeah.
What about massage therapy or seeing a chiropractor?
So the question, do I have to repeat the question? Massage therapy is fine. Massage therapy will really help with the muscle component of your pain, which may exist because, as I told you, muscle is a compensatory mechanism, meaning you have muscle pain because now muscles are slacking or picking up the slack of all the other stuff, disc, joints, and stuff. So massage therapy will help with the muscle pain. Chiropractor, I don't necessarily recommend, only because some of the manipulation they do, if they don't have an exact idea of what's going on in the disc, they may certainly make the disc tear and herniation worse. I 100% respect the chiropractor as a specialty and as individuals, but a lot of their evaluation treatment is based on X-ray and not MRI. And MRI is really the key component that can show you what's going on with the disc, your spinal cord, and your spinal nerve roots. So chiropractor may be helpful if you just have simple arthritis in your lower back, but if you start having degeneration of the disc, radicular pain, spinal canal stenosis, all that mixed in the picture, it can get a little dicey. Yeah. Yep, in the back.
I have some. It's ridiculous.
Mhm.
My left leg and my foot.
Yep.
My doctor wants, the orthopedic doctor wants to have an EMG.
Mhm. Yeah, so the question, yeah, sorry.
Well, he said something like, oh, we'll be able to see whether it's central or.
Yes, that
I
is correct.
understand it's very painful. And
Right. So the lady in the room asked, she has radicular pain in one of her legs, and her doctor recommended a study called EMG or electromyogram. And she was told that this was to help differentiate or tell apart between the central pain or more of a peripheral pain. And that is correct. Now, usually if there's radicular pain, again, highly suspected that it's coming from the back. And usually one of the things that physicians will do is get an MRI. Now, if the MRI shows a clear picture of the disc or joints pushing around the nerve root, problem solved. Likely that is what's causing it. If your MRI is rather clean, then it kind of brings up the question of, you clearly have radicular pain, clearly a nerve involvement, but why doesn't MRI show anything? And there is a test called electromyogram where they use these needles and they test the integrity of your nerve. And they test the speed of it, they test your muscle twitch, all that stuff. It's not really a pleasant test. I don't know if you have gone through it before. It's not the most pleasant test because there's some of the needles stuck in your legs. But basically, it is able to differentiate or tell apart whether it's coming from your spine or whether it's you're having a nerve issues outside of the spine. And one of the examples where you can have a nerve issues that's outside of the spine is diabetes, for example. Okay, or if you had a knee injury or leg injury that may have caused some nerve injury, for example, that could be another reason. Okay, or sometimes even if the MRI doesn't show anything, that EMG test can tell that it is actually coming from the back. Because MRI is not perfect. MRI is a still image, it's a snapshot of you lying down, but you don't spend lying down forever, right? You do all that stuff. And whenever you're doing all these stuff with your spine, at a certain point, you're going to push on the nerve. And at some point, that's going to cause some shooting down pain. So just because MRI is negative doesn't necessarily mean that your radicular pain is not real, nor that it's not coming from the spine. Okay. Yeah, quite the question. Sorry, okay.
I'm guessing that it's sciatica going down my left leg.
Mhm.
And interesting because at night, I mean, I toss and turn a lot, but as soon as I go onto my back flat,
Mhm.
the pain goes away immediately.
Mhm.
So why is that?
You know, I wish I was there to see your actual posture, but to reiterate the question, she's asking when she's tossing and turning around the back, she has this radicular pain, or it seems like, but when she lies flat on her back, her pain goes away. I would imagine when you're lying flat on your back, depending on the mattress, depending on posture, maybe your back is positioned in such a way. I would assume that it's back straight, but depending on how your anatomy is, you know, depending on your anatomy, depending on whether you have scoliosis, all that stuff. You found the perfect position where your nerve or your spinal cord is least bothered, okay? And that probably is that golden position that you found that helps with the pain. Now, it's not to say that that position will be helpful for your back, but rather you just found a position where it puts the pressure on your nerve root the least. I hope that helped your question.
And
Mhm.
when someone comes to see you for the first time,
Yeah.
I don't know if it's a concept or whatever.
Mhm.
One of the first things that you do is do an X-ray or an MRI so you can see what the problem is with that person.
Yep. So the question was, if the patient comes to see me as a consult or as a new patient visit, what do I do? Like, do I order an X-ray? Do I order an MRI to figure out what's going on? And the way I treat patients is whenever they come in, unless they had an X-ray or MRI pretty recently, I get an X-ray right away because I need to rule out any sort of fracture, mass, or anything dangerous. So that's the first thing I do, bar none, or bar that points I just mentioned. And then I examine you. I do a physical exam. I get your history and really try to figure out what is causing your pain. As I told you, all those different types. I try to really narrow them down into types. And depending on how bad your pain is, depending on the types, depending on what kind of other symptoms you have, numbness, weakness, can't walk, can't go to the bathroom, etc., I will kind of tailor my plan as to whether this individual needs a physical therapy right away. No, this patient needs an MRI right away. No, this patient needs to see a surgeon right away. Or maybe she had all these things done and she needs an injection, and she didn't have the injection that she should have had with other physicians. So it really kind of gets into what kind of medical history you had in the past, what you have had in the past, and also what kind of symptoms you have, not only just pain.
Thank you.
Yeah, no problem.
Are these
Yeah.
steroid injections addictive?
The question is the steroid injection addictive? The steroid injection is not addictive, but you need to watch out for getting frequent steroid injection, because the risk of steroid injection is it can mess up with your sugar level temporarily. It can cause hot flashes occasionally. And if you get it so frequently, so for so long, it's actually not good for your joints or your disc. It will actually speed up the degeneration of those things. So it is my responsibility and all physicians' responsibility to make sure when you do get steroid injection, we space them out, okay? So you don't have to keep tracking your calendar of when the next steroid injection is due. We'll do that job for you, okay? But that is our responsibility. Yep. Any other questions in the room?
We don't have any online questions, so
Awesome. Right.
anyone else in the room have a
Anyone
question?
else? I'm not going anywhere.
Free to ask you.
Yeah, I don't bite.
Dr. Lee, again, we thank you so much.
Oh, thanks so much for having me.